This patient had obviously quite a significant varicose veins. As you can see, it has been marked. It goes from the ankle all the way up to the thigh area. It was quite a significant, huge varicose veins, and we have performed sclerotherapy last week on the vein, and obviously the vein now is no longer as bulging as before. It has shrunk. So basically the sclerotherapy involved us injecting a medication into the vein, and that caused the vein to collapse and shrink. And then over time, it will just dissolve by itself. So today we are going to perform a bit more sclerotherapy in some of the branches of the big vein that we have done. We will start on the feet area. Obviously, prevention of infection is very important, so we'll clean the skin with some antiseptic. So this medication is called Fibrovain. It has been medically approved or TGA approved for sclerotherapy. And what I'm going to do is we're going to use the smallest needle possible, and we'll just do a small little injection. Okay. And we just want to make sure that we are in the vein. And then we will inject the medication into the vein. Okay. As simple as that. Now, as a result of the injection, the medication will cause the vein to shrink. And then, as I said, over time, it will just dissolve by itself. So these are spider veins. As you can see, they are smaller in nature. Okay. So not only we want to treat it medically, and that's to remove the varicose vein, but we also want to achieve a good cosmetic outcome for the patient. And these spider veins are sometimes quite unsightly. So just a small little sting here. See how the veins blanches. If it becomes very severe, it can be dangerous in the sense that patient can get blood clots if they're traveling long distance, let's say to Europe or to America. And if it's not treated over the long term, patient can get ulcers. And sometimes those ulcers are hard to heal because of the poor circulation in the varicose veins. So as you can see, it's not a very painful procedure. As long as it's done properly and with the right injection technique, most patients just feel like a tiny little ant bite. Yeah, it's one of the safest procedures around. I mean, compared with the traditional method of removing varicose vein, and that is called stripping. It's a surgery. It has to be done under general anesthetic, and obviously there are all sorts of risks involved with general anesthetic. In this treatment, as you can see, after the injection, we'll put the stocking on, and the patient can just walk out of here. So it's basically a walk-in, walk-out procedure. And over the last 18 years, we probably have done more than 15,000 cases. Touch wood, there isn't much problems with it. Most patients are happy with the results of the treatment. Yeah, it's very dependent on the severity of the veins. Usually it ranges between 2 to 3 treatments. There are a few factors that causes varicose vein. One is genetic. The other are hormonal changes, pregnancy, prolonged standing. So there are quite a number of reasons why people form veins, but genetic factors is the most important reason. If your father or mother have varicose veins, it's more than likely you might inherit that genes. So the patient will have to wear a special compression stocking for 2 to 3 weeks. And what it does, it helps to support the leg and compress the vein so that the varicose vein doesn't reopen back again. Okay, this device helps me to slide the stocking in a bit easier. Okay, just lift the leg up a bit, please. Okay, here you go. Okay, Chris, can you get you to pull it up all the way up? Thanks. Pull that all the way up. You feeling okay?
Yeah, good.
Okay, that's good. All done. Okay, good. That's it.